At night, when we bid our family good night, we do that with the hopes of waking up in the morning and seeing them again. For some of us, things don't turn out right. We don't get to wake up. A few percentage of our people die from sudden nocturnal death. Death that occurs between the hours of 10 p.m. and 6 a.m. Such people die because by the time we chance on them, it's too late, and therefore care is delayed. Several conditions can increase your risk of dying suddenly in your sleep, especially when you have a cardiac or a respiratory arrest. Cardiac arrest comes from a heart that is weakened and is not functioning correctly. Also, respiratory arrest happens because your lungs are not beating and working like it should. All because you could have an underlying chronic condition that is not managed well, or you could have a terminal illness such as an oncological problem like cancer, which changes how your body clots. Sometimes people with cancer clots easily and causes them to throw a blood clot in their bloodstream, which could cause them to have a heart attack. They could even have a stroke, which is a brain attack. When a stroke, something similar like a stroke happens in the heart, we call it a heart attack or myocardial infarction. A clot can block the blood vessel that feeds the brain and give you a stroke. The same clot can also block the blood vessels that feed the heart muscles and give you a heart attack. So those are similar in that instance. Like I was saying before, a cardiac arrest from cardiac failure, a heart that has failed, or a respiratory arrest from a lung or pulmonary, your heart, your lungs, that is not functioning right, could cause you to die in your sleep. Some of these conditions, or you maybe have both conditions, which could make you die prematurely in your sleep. Some conditions like obstructive sleep apnea, people who don't breathe well in their sleep. You see, the body is designed such that you take oxygen in to feed your tissues, and then the cells of your tissue, through their metabolic activity, generates carbon dioxide, which you breathe out. In the same way, when there's a carbon monoxide from appliances that we use around, let's say you have a space heater, right? Like some of us in the diaspora who cannot handle cold conditions and therefore have portable space heaters. If there is no ventilation in the room and the heater generates carbon monoxide and you close all the windows, you stay in and you inhale it, it could suppress your respiratory drive and cause you to die in your sleep, in the sense that the gas exchange doesn't happen like it should, and carbon monoxide accumulates. The level goes higher. It changes the pH of your bloodstream. The same way carbon dioxide can do too. If your cells generate carbon dioxide that is supposed to be expelled out of your body, and for some reason your lung is not functioning at full capacity and makes you retain that carbon dioxide and the level goes up, it changes the pH of your body, right? It makes it not conducive for your heart to beat anymore, or your lungs to work anymore, your organs to work anymore. So then it fails and you can die. There are several other conditions. Let's say you have diabetes that you have not been treating it, or high blood pressure, you have not been treating it. The diabetes can damage the arteries, the walls of the arteries that supply blood, nutrients to your tissues. And that can cause you, to have a stroke or other symptoms too. Let's say you have high blood pressure that you have not treated and it leads to a left heart failure. That left heart failure can cause fluid accumulation in your lungs and decreases the lung capacity, the space available for the lungs to exchange air. When that happens, you have only limited or sometimes no room at all for gas exchange, which causes you to accumulate the same toxins, such as the carbon dioxide or carbon monoxide that you have inhaled that needs to come out. It stays in your system, and as the level goes up, it overwhelms the body, it changes the pH, causes organs and functioning of your body not to do right. And then you can pass out, get into a coma, or die. The other conditions like a seizure, if you suffer a seizure in your sleep, and let's say you vomit, right? Let's say you drink too much and you are already sedated from the alcohol, because the alcohol suppresses your respiratory drive. It works on the central nervous system and suppresses your respiratory drive, and you throw up, you can, in your sleep, and you can't manage your secretions because you are sedated from the alcohol. You can choke on that vomit and also die in your sleep. It happens to people. When you have any condition that affects the brain stem, the part of the brain that is on the back of your head that controls your breathing, anything that suppresses the brain stem, it could cause you to not exchange your gases correctly, which will eventually impact your brain functioning, make you very dizzy, drowsy, and eventually you die in your sleep. The same way, let's say you have a stroke in the part of the brainstem that controls your respiratory rate, or you have an internal bleed. Someone hits your head with an object, and you bleed in there, and it suppresses the function of that part. It will cause the same symptoms. So there are several things that we need to be watchful and protect ourselves from to decrease our risk from the sudden nocturnal death, because all these things can happen to us. Death is no respecter of person, but equipping you with this knowledge ensures that you decrease your risk and prevent those conditions from happening to you, so you don't end up dying prematurely. People who take substances and abuse them, let's say you take crack cocaine, you abuse oxycodone, you abuse any street substance at all, it suppresses your respiratory drive. You know how sometimes you breathe very fast to blow off CO2? Or even when you're in a smoky condition and you get smoke inhalation, you breathe fast to kind of help you get more oxygen into your body and get rid of carbon dioxide or whatever content that you are inhaling. It's the same process. So anything that prevents you from, having that breathing pattern as you need it will cause you to lose your life, because you're not compensating anymore. Your lungs are there, and they are controlled by a part of your brain that helps you breathe like you should. The same way your heart beats too, and is controlled by part of your brain that causes you to breathe. The autonomic nervous system, you don't have control over it, but your body works together to connect you to breathe. And sometimes you have control over it. You have the sympathetic, parasympathetic nervous system, which makes the autonomic nervous system, right? So the activities that you have control, like let's say there is smoke in here and I'm breathing faster to get out, or maybe I'm coughing to get something out. Those are reflexes that I have control over, and I'm trying to cause it to happen so I can survive. But when you are sedated, you can't function in that capacity anymore. So be watchful if you abuse substances. If you have sleep apnea, get it treated. If you have high blood pressure, manage it so it doesn't destroy your heart and cause you left heart failure or any right heart failure or any kind of heart failure. Also, if you are someone who has diabetes, get it treated. If you have lung disease, get it treated. If you have a seizure, make sure you take your medications so it doesn't happen. There are several things that you need to watch out for if you have a chronic condition, by managing it well so it doesn't end up killing you. Because sudden nocturnal death doesn't happen, but it does occur, and the death happens between 10 p.m. and 6 a.m. where most of us are asleep, and someone may not see you, assess you, and ask for a quick medical attention. So protect yourself that way and save yourself. Thank you.